This conference will now be recorded.
Hello. All right, let's talk about accident and health. This is a bit of an overview. Kind of give you some insight. Let's go ahead and get started. So, this is what we're going to be covering. Some of the items I'm probably going to divert you to another webinar, but this is pretty much what's going to be on this particular webinar right now. Okay. So we're going to start with the National Association of Insurance Commissioners Model Laws. What this is we get all the commissioners, superintendents, and directors from all the Department of Insurances from all the states, put them in a big conference room, and they create what's called model laws. Actual laws, they're just guidelines for the insurance industry to follow. The priority is to kind of help between all the states. So it doesn't matter if you're in and you need a license to sell life insurance. The procedures are basically the same. Okay. You do need to know that there are 12 mandatory provisions. So I didn't them because you don't need to know the numbers, okay? But you need to know that there are 12. So let's go ahead and run through it. First of all, the entire contract provision. The policy and when attached to the application, the two parts together, the policy and application, right, make up the entire contract. The reason we have this is if we have a dispute with a contract, the courts do not look at just the policy. They do not look at just the application. They look at both parts together, right? Because they got to be in sync and determine that it's a valid contract. Right? Time limit on certain defenses is a health insurance way of saying incontestable clause. Your policy becomes incontestable after it's been enforced for 2 years. Okay? So now after 2 years in life insurance, there's really only one reason the insurance company may cancel you out, and that's for non-payment of premium. But in health insurance, after 2 years, there's actually two reasons an insurance company may cancel you out. Number one, non-payment of premium, right? But number two, fraud. Fraud can void your health insurance contract anytime that is deemed fraud and can be proven by the insurance company. Right? So that's kind of what that's about. Now, the first 2 years, if you suffer loss and the insurance company's research and they realize you lied on your application, they can actually deny coverage for that. Okay, but after 2 years, they typically got to pay. Grace period. After your premium due date, you've got some time to still pay the premium without incurring a late fee, right? And having to go through another medical exam. This is called a grace period, right? If you suffer loss during the grace period, you are covered. Now, the grace period depends in health insurance on how frequently you pay your premium. If you're paying your premiums weekly, you have a 7-day grace period. If you're paying your premiums monthly, you have a 10-day grace period. And if you're paying your premiums quarterly, semi-annually, or annually, you'll have a 31-day grace period. Okay, so 7, 10, 31. Keep that in mind. Now, if you suffer loss during the grace period, you are covered, like I said. If you don't pay the premium by the end of the grace period, your policy will lapse for non-payment of premium. Well, that's okay, because the next provision says you can apply what's called reinstatement. To reinstate a policy that you let lapse for non-payment of premium, you need to do 4 things. Number 1, you have to apply for reinstatement. Number 2, you're going to have to pay all the past due premium that you should have paid. Number 3, you'll also have to pay interest on that past due premium that you should have paid. Okay. And number 4, in some cases or most cases, you're going to have to go through evidence of insurability. That means you're going to have to go through an underwriting or medical exam again. Okay? In case your condition has changed from when they first insured you, then they may not want you back. Okay? But like I said, you can reinstate a policy that you let lapse for up to 3 years. Okay? Now that's standard for life and health typically. All right. This next section is dealing more with claims. All right. So notice of a loss. Number 1, if you suffer loss, you must immediately, typically in writing, notify the insurance company that you suffered a loss. So notice of a loss is immediate. Sometimes you'll see immediately in writing on your exam. Now, once you give the insurance company notification you suffer loss, there's 3 things are going to happen in the next 15 days. Number 1, the insurance company is going to acknowledge you suffered a loss. Number 2, they're going to begin their investigation. right? And number three, they're going to send you claim forms. That's the next provision here, okay? So I kind of call it the ABCs with respect to notice of a loss: acknowledge, begin the investigation, and send the claim forms. Now, your job is to fill out those claim forms because within 90 days of the loss, you need to submit your proof of loss, right? Proof of loss would be your medical bills, your doctor's statements, and things like that. Basically, a third party supporting your claim that, yes, you suffered loss, and these are the charges, okay? Now, once you submit due proof of loss, the insurance company is supposed to pay the claim immediately. So time of payment of claim should be immediately, okay? If they do not pay within 30 days, actually, they should pay within, well, immediately, I should say. If they don't pay within 60 days, we'll go to another route, okay? We'll get to that in just a second. Payment of claims provision says, who do we pay the claim to, right? Sometimes this is called an assignment. So in some cases, we'll actually pay the doctors directly, which is a service plan or policies that provide benefits on a service basis. We pay the doctors and the hospitals or the service providers directly. But some companies allow us, the insurance company, to pay you. Reimbursement or indemnity programs where the insurance company actually pays you, okay? And in some cases, there may be a beneficiary, like for disability income or accidental death type of contract. That would be, you would name a beneficiary on that. Okay? But the payment of claims provision says who we pay the claim to. Medical exam or autopsy provision. If we, the insurance company, request it, we, the insurance company, pay for it. So typically when you purchase insurance, there may be a medical exam to see if you're insurable, like especially for life insurance, okay? Since the insurance company is requesting it, they pay for it, right? Likewise, at the time of the claim, right, they may have to do another medical exam, and or if it's a death, it may request an autopsy. And again, the insurance company has to pay for it, okay? Okay, so let's go back to you submit proof of loss. You haven't heard back from the company within 60 days, then you might want to take the 12th provision here, legal action. Possibly hire an attorney and sue the insurance company for the proceeds of the policy. Okay. So again, upon due proof of loss, they should pay right away. If not, within 60 days, you might want to talk to an attorney and initiate a legal action. Okay. Now, if you're going to sue the insurance company, right, you can't sue them within the first 60 days of submitting proof of loss, right? But typically, you're going to have to sue them within 3 years of the claim. Statute of limitations on most claims ends in 3 years. Okay. So these are 12 mandatory provisions that are typically found in your individual health policies, right? And some of them are found in the group contracts. Now we have 11 optional provisions. You don't really need to know all 11. Get the logistics of it. Okay. Again, they're not going to ask you what is optional provision number 2. Okay. They'll give you more information about it in the question to help you come to the right answer. So change of occupation. If you have an individual policy and you're paying some high premium because you have a high-risk job, if you switch to a low-risk job, I'm on the impression you're going to notify your insurance company, hey, you know, I have a reduced risk, change of risk. My change of risk has been reduced because I'm working in a more conservative occupation. Reduce my premium like that. And most people probably do that. But if you're in a low-risk job and you switch to a high-risk job, most people aren't going to tell the insurance, excuse me, I switched to extremely risky occupation. Can you please charge me more premium? Okay. So it's an optional provision in your contract. If you change to a more risky occupation, insurance company will still pay on the claim, but they'll reduce what they'll pay to reflect the increase in risk. Misstatement of age or sex. If it is determined there is a misstatement, the insurance company can adjust the benefits to reflect the age or the true sex of the individual at the time of the loss. Okay, I mean, basically provides you with what you should have had based on your age and sex when you purchased it. If you have multiple policies with the same company, all right, there's a couple ways of handling it, by the way. Number one, if they're similar, they could prorate a percentage. If they're slightly different, one could be primary, one could be fixed. But if they're totally the same, there's another way of handling it is we'll have one pay the claim, right, and then we'll cancel the other one and refund your premium. Right? But I'm not sure which option your company may take, but usually that's expressed in the contract. If you have insurance with other insurance companies, again, there's a coordination of benefits type of provision of how, you know, maybe your policy will be primary or your policy will be excess, right? Or if it's similar, then they'll pay on a prorated basis. With disability also, they'll personally coordinate benefits with the other insurance company, right, to keep you from getting a gain. Which is the next topic, keeping up with the disability, relation of earnings to insurance. You cannot insure for more than you would normally earn while working. So even though you bought multiple policies, all of them combined cannot exceed what you would normally earn while working. Most insurance companies only let you insure about 50 to 70% of your gross weekly wages, right? Gross wages minus taxation in that 50 to 70% range. So that's all they're going to let you insure. The unpaid premiums provision. Right? So I said before that if you suffer loss during the grace period, you are covered. Some companies have a provision that says if you suffer loss during the grace period, we're going to go ahead and pay the claim minus the premium you should have paid during that period. Right? And so again, these are optional provisions. They may or may not be within your contract. Cancellation, basically 3 types of cancellations. We have prorate, short rate, or flat rate. Right? And so usually there's a provision defining which one, if the insurer or the insured cancels out. Conformity with state statutes. If your policy does make some changes, right? Maybe the insurance company for some reason wants to cut back on some of the benefits, right? As long as it conforms to the minimum standards of state laws or state statutes, right? That'll be fine. Your insurance company can be more liberal in the benefits, but they cannot be more restrictive than what the state law says. Another optional provision will be illegal occupation. So if you're injured robbing a bank, your policy typically will not cover that, right? So, and if you're under intoxicants and narcotics, this is optional again, that your policy may not pay for your medical care. So, whenever you sell insurance, you get a hold of a policy that your company's offering. And you're probably not going to read the whole thing, although I kind of encourage you to. But most people won't. But I'm going to recommend that you at least read the limitations and exclusions in the contract and point that out to your prospects and clients so they know what's not covered by the contract or what may have limited coverage in that contract. Okay? All right, for individual policies, whoever owns it is the one that's controlling it. So you're the premium payer, you're the owner, you choose which benefits you want on the policy. A free look period. When someone purchases a policy and it goes through underwriting and the company issues it, you're going to typically deliver it. Okay. Now, when you deliver the policy, when that client receives it, they get a free look period. It's usually 10 to 30 days. So we, the insurance company, we're going to send it to the client or give it to you, the agent. You're the agent. You're going to deliver to the client. And that you have to have them sign a policy delivery receipt, by the way. Okay. So they acknowledge and you acknowledge when the free look period begins. During this free look period, they have the right to inspect and review the policy, right? Take it to their friends, even their attorney, to review it to see if it's a good purchase for them. And if they're not happy with it for any reason whatsoever, they can return it during that free look period, and they're entitled to a full premium refund. Now, for most people, it's typically 10 days. Anyone who is 60 years of age or older automatically gets 30 days. Okay. Now, and by the way, anyone buying long-term care, doesn't matter how old you are, you automatically get a 30-day free look period also. Benefit payment clause just describes what benefits are going to be paid, okay, how it's paid. Eligible expenses, a lot of your policies for health insurance will pay what's called usual, customary, and reasonable charges, UCR charges. Right? What that means is this is the average rate for medical procedure in the area that you live or work in. Okay. And that's what your policy will pay. So if you go to a specialist and they charge you $10,000, that's the actual charge, but your company's UCR charge is $8,000, well, I'd probably negotiate with that doctor, see if they can drop their actual charge to match your UCR charge. Some doctors will, some doctors won't. That means you're still going to have to pay the difference, and that could be above and beyond your deductible and coinsurance. Okay, so see what's eligible, what's not. The assignment we kind of touched on. Excuse me. That's assigning your claim payment. All right, so remember, service providers like Blue Cross, Blue Shield, HMO, PPOs, you go in to get the care that you need. They may send you the bills. You give them to your insurance company, and then your insurance company pays the medical care providers or pays the doctors and hospitals directly. That's a service plan. Some companies, reimbursement or indemnity programs, actually give you the money, right? And once they give you the money, it's either reimburse you because you already paid the doctors, or basically provide you with the money to pay the doctors. Right? Now, some companies give you choice. This is called an assignment, where you can assign your claim payment. Right? You can assign it directly to the providers or assign it to you to pay the doctors and hospitals yourself. Renewability. Right? There's different types of renewable programs. This list right here is listed from the cheapest type of policy, using the terminology, to the most expensive. Right? Cancelable is going to be cheaper, right? Because the insurance company can actually cancel you during the policy period. They typically will give you a written notice, but they can cancel you during the policy period. That means midstream. Okay? Optional renewal means the insurance company cannot cancel you during the policy period, but at the end of the policy period, the insurance company reserves the right to renew you or not renew you. And if they choose not to renew you, they don't even have to give you a reason. It's just their option. So it's going to be a little more cheaper also. Cancelable is the cheapest, but optional renewable will be the next cheapest, because the insurance company has a lot of control to reserve the right to renew you or not renew you at their discretion. Conditionally renewable. Well, it's stated in your contract that upon renewal, if you meet certain conditions, well, then you'll be able to renew. But if you don't meet those conditions, then the insurance company does not have to renew you. Right? And so again, your renewability is based on you meeting certain conditions in the contract that are fair. Okay. So I had a client a while back. He had a weight-related diabetes. Okay. And so it was a condition in this policy that upon every renewal, they had to bring him in and put him on the scale. Right? Now, anytime he's below the weight specified in the contract, we renew him, no other questions asked. But if he ever comes in and he's over the weight stated in the contract, the insurance company can choose not to renew him. Okay. This condition was imposed because it's good for my client, helps him maintain lower body weight to prolong his life. Diabetes miraculously goes away, right? But it's good for the company. Anytime that he comes in, he's overweight, they can drop him, which reduces the risk for them. So that's kind of what it was back then. Okay. Now the next one's guaranteed renewable, and the non-cancelables right after that. Now these two are quite similar. With both of these, all the customer has to do is pay the premium. Right? Guaranteed renewable guarantees renew as long as you pay the premium. Non-cancelable, all you got to do is pay the premium. In these two, the insurance company cannot change any terms, provisions, or benefits in the contract. You just pay the premium, and the coverage will be there. The difference between these two is guaranteed renewable means, let's say you have a 5-year guaranteed renewable contract. That means after 5 years, you're guaranteed to renew as long as you pay the premium. However, you're 5 years old from when you first bought the policy. So your rates will go up every 5 years on your renewal, right? And as long as you pay the premium, you're guaranteed to be insured, okay? The downside of that is at older ages, the premium can go up exponentially, and you could be left without coverage at older ages when you still need it the most, okay? So non-cancelable is a little more expensive up front, but you have level premium from here on out. Okay, so it's kind of like comparing the 5-year renewable term with a whole life policy. Whole life would be the non-cancelable policy. It's more expensive initially, but your premiums remain level for the rest of your life. Guaranteed renewable would be like a 5-year renewable term. Every 5 years, your rates go up. Okay. Coverages stay the same, but your premiums go up on every renewal. Okay. So there's a couple questions you may get here. Typically directed towards long-term care. Right? Most long-term care policies are sold as which of the following? Guaranteed renewable. Okay? Now there's another question that says, with all things being equal, what should you, the agent, recommend? And you should recommend non-cancelable. Right? So even though it's guaranteed renewable, your rates are going to go up. And as a senior citizen on fixed income, I don't think you want increasing premiums that guaranteed renewable will provide. Right? So non-cancelable is what you want to recommend. Now that's just for the test. Out in the real world, it's kind of tough to find non-cancelable policy for long-term care. Okay, but for the test, you just want to make sure you get the concepts down. For group insurance, again, the owner has the rights of the policy. That would typically be like an employer. Right? I'm going to use employer-employee. That's the most common group. It could be a labor union, association, maybe even a trust. Okay. But the owner controls the policy. Now, for employees to show that you are part of this policy, you get a certificate. So the employer is the master policy holder or master contract holder, and the employees get a certificate to show that they're part of the group program. Okay. There's a benefit payment clause telling you what benefits are covered, right? It'll state eligible expenses, right? Just like in the personal lines, right? If we have multiple insurance companies for group insurance, we have something called coordination of benefits of the COB provision. So I'm going to use a traditional married couple situation, right? We have a husband working for a company. He has health insurance for his company. He's going to name his spouse as a dependent. Well, the wife has a job, has health benefits through her company, and so she's going to name the husband as a dependent, right? So they each have coverage by the company. They name each other as a dependent, right? Under the coordination of benefits provision, if the husband suffers an injury, his company's policy will be primary for him, and then the spouse's policy will be secondary for him, right? And in contrast, if the spouse, the wife, suffers an injury, well, then her company's policy will be primary for her, and then the husband's policy will be secondary and fill in any gaps if there's any gaps, right? It's just keeping them from overinsuring or underinsuring, okay? Well, there still may be underinsurance, but it keeps them from overinsuring. That's how that works, okay? Conversion, right? So let's say you leave a company, right? You can convert your group employee benefits to an individual program without evidence of insurability, but you got to convert within 31 days, right? So maybe your group life insurance or group disability income, you leave the company, but you want to keep that coverage, you can convert it to an individual policy within 31 days without a medical exam, okay? That's conversion. COBRA is only health insurance. So you can't COBRA your group life, you can't COBRA your group disability income. It's only, you want to view it as continuation of group health coverage. COBRA stands for Consolidated Omnibus Budget Reconciliation Act. Okay. I don't know who came up with that, but that's what it is. Right. So COBRA. So you leave a group, you can continue the same group employee benefits for health insurance you had when you were a covered employee. So if you're an employer, you have 20 more employees under federal law, you are required to provide continuation of group health coverage under COBRA. Right? Once they terminate you from the group, right, then they'll send you notification statements. Right? You have 60 days from that notification statement to sign up for COBRA. Now, you're typically going to pay your portion of the group premium plus up to a 2% admin charge to keep you on that group insurance program, group health insurance program. And it's the same stuff you had as a covered employee because you're on the same program. Versus conversion, you're breaking away to an individual policy. You don't have the purchasing power of the group behind you. So even though the premium may be a little bit better, you're probably giving up some of the benefits. Now, COBRA will let you stay on the group program for 18 to 36 months, depending on why you left the group. Right? COBRA is designed as traditional health coverage. Right? You leave a group, you pay for the COBRA health insurance policies, right, until you get hired by another company and get on their group program. Right? One other thing about COBRA, if you were terminated for gross misconduct, you forfeit COBRA. Right? So, but other than that, 18 to 36 months, depending on why you left the group. Now, OBRA extends minimum COBRA. So if you were disabled at the time of termination, normally for termination of employment is 18 months, right? But if you were disabled at the time of termination, OBRA will basically give you 29 total months. So it gives you 11 additional months with a maximum of 29 months to stay on COBRA. Okay, so OBRA extends minimum COBRA. So I want to emphasize this. COBRA was there first, and OBRA came out later on, just so you know. So C comes before O. I don't think that they had OBRA first and they added something to it. Now we have COBRA. No, COBRA was there first. OBRA came out later. Okay. All right, for disability coverages, this is where I have other webinars. So they're recorded, they're on my site. We have the medical health coverage, talking about the basic medical, comprehensive, Blue Cross, HMOs, PPOs, and EPOs. So watch those other webinars. Disability income coverage, I do have another webinar also. It's pre-recorded, so you can access it anytime. And also long-term care. The main thing about long-term care, it does not cover acute care. Long-term care doesn't provide medical care. It covers you get released from the hospital, but you can't quite do things on your own. Maybe you have severe arthritis where you have trouble getting dressed, buttoning your clothes, and you need someone to help you out with that. That's where your long-term care policy kicks in and helps afford, in most cases, someone to help you take care of that. Okay? So I'm not going to go too heavily into this because it's on those other webinars. Social insurance. Well, the biggest one we have is Social Security. So the government is an insurer. They're not an insurance company like a stock insurance company, a mutual insurance company, reciprocal, fraternal, right? But they are an insurer. Right? Now, Social Security, they take 7.65% out of your paycheck, and every quarter your employer has to match another 7.65 and basically present 15.3 to the IRS every quarter. Okay, so you have to pay into the system. So you earn quarters of credit or quarters of coverage, you might say. To achieve fully insured status, you have to pay in for 40 calendar quarters. It's basically 10 years. There's other statuses like 20 quarters, that's basically 5 years. You've achieved partially insured status and can be eligible for certain benefits. And if you paid in 6 quarters out of a 13-quarter period, this is called specially insured status. Right? You can actually qualify for disability income and survivor's benefits if you paid in. Right? So if you pay into it, Social Security was originally created to provide retirement benefits. Right? And so if you are fully insured status, you can take early retirement at age 62, but you only get 80% of the benefits from then on. So you'd have to postpone retirement to age 65 or 67, depending on when you were born, to get the full retirement income benefits. Okay, so keep an eye out for that. Survivor's benefits, there's 2 types, right? Lump sum of $255 for death, someone who's covered under Social Security, lump sum of $255, that's it, okay? And income to your surviving spouse if they have minor children, okay? If they don't have minor children, then your surviving spouse only gets the lump sum of $255, okay? Now that survivor's income for minor children, we're going to pay your surviving spouse income until the youngest child turns age 16. Once the youngest child turns 16, then the Social Security survivor's income benefits end. The surviving spouse will not be entitled to any, income until age 60, because they're a surviving spouse. They can actually take early retirement at age 60. Okay, so that period of time from when your youngest child turns 16, but before your surviving spouse turns age 60, there are no Social Security survivor's income benefits payable. This is called the blackout period. All right, so make sure you're familiar with that. All right, where no Social Security survivor's income benefits are payable. All right. The next benefit Social Security provides is disability income, but it only pays for total disability only. There's no benefits for partial disability. This is probably the most restrictive definition of a disability you'll see. Social Security defines total disability as the inability to engage in any substantial gainful work activity due to physical or mental impairment. That disability must last 12 months or is expected to end in death. Right? Now, you got to meet that definition. If you meet that definition, then you're eligible for Social Security disability income benefits. However, once you qualify, you still have a 5-month wait before they cut you the first check. Okay, so Social Security disability has a 5-month waiting period. Another way of saying that is Social Security disability income benefits will begin on the 6th full month of total disability. Right? Yeah, so that means if you suffer a disability, you qualify for Social Security, you got to wait 5 months. Now, when it pays on the 6th month, they will go back and cover the first 5 months, but you got to hold out for that time period. Okay. And then the other benefit we have under Social Security is Medicare, and I'll talk about that a little bit later. All right. Another social insurance type program is Medicaid. It's called Medicaid throughout the nation. Here in California, it's called Medi-Cal. It's our California state version of the federal Medicaid program. This is actually state and federal government working together to provide a socialist type health care for people who cannot afford it, right? Medically needy, medically indigent, people that are on SSI or SSP, refugees in the country 18 months or less, right? Certain children in foster care, adoption assistance programs, blind and disabled, anyone needing kidney dialysis, low income under age 21 or over 65, and again, persons in skilled nursing or immediate care facilities that are low income. So again, this is kind of the last resort. When you don't have any assets to pay for your medical bills, then you could apply and you could qualify under the Medicaid program. Okay. For taxation, so for group disability income, so let's say you work for a company and your employer is going to provide disability income benefits for you, which is awesome. Right? Your employer, because it is a employee benefit, it's a business expense, and the employer gets to use tax-deductible premium for that program. Right? That means if you, the employee, suffered a disability, those benefits are actually going to be taxable to you. Okay. So for an individual, right, if you ran out and bought your own disability income policy, you're typically going to use after-tax premiums to pay for it. That means should you, the individual, suffer a disability, your benefits will be tax-free. Okay. Now, health insurance, it doesn't matter who pays for it. Whether your employer provided it as an employee benefit and gets tax-deductible premium, or you bought it yourself using after-tax premium, the benefits are going to be tax-free. Because we're paying for medical expenses that are already incurred, so it's not we don't have a tax issue. But disability income, we're replacing income, earned income, which is normally taxable. That's why somebody has to pay the taxes. Since your employer didn't, you will. But if you bought the policy, you already paid the taxes, so you get tax-free benefits. But for health insurance, like you said, it doesn't matter who paid the premium, whether it was tax deductible or not, the benefits are going to be tax-free. Okay. As far as coverage for seniors, part of Social Security, we have Medicare. Okay. Part A covers hospital. Typically, you pay into it, you've earned it. So essentially, it's free for most people. So you're 65 years of age or older and have earned it by paying in Social Security. Or you're 65 years of age or older, you have not earned it, but are willing to pay premium for it, you can be entitled to it. And also, anyone who's been on Social Security total disability for 24 months, they automatically bump you onto the Medicare program, regardless of your age. So people associate Medicare with seniors, but not necessarily everyone has to be a senior, okay? So remember, Part A is paid for by Social Security, right? Payroll taxes, right? Part B is the medical care. Part A is the hospital, covers the bed. Part B is the medical care of the doctor and surgery. And so Part B, you sign up, you pay premium for it. Okay. So both of them have deductibles, right? Part B has co-insurance, 80-20. You pay 20%, Medicare pays 80% after you've paid the deductible. Okay. But again, you got to sign up and pay premium for Part B. So you earn Part A, hopefully, you sign up, you pay premium for Part B, and what you can do is trade it in for Part C, which is Medicare Advantage. This is private insurance companies that are basically working with Medicare to basically take over and give you HMO and sometimes PPO coverage as a senior. All right, so rather than having those deductibles, co-pays, co-insurance that Part A and Part B do, all right, then you trade it in for Part C. Sometimes you typically will have some additional premium. And then you have HMO PPO as a senior, which is kind of nice just to have a copay for covered services. So Part C is private insurance companies. All right, and then Part D, we're going back to the federal government providing prescription drugs. Part D, D for drugs. That's how you want to understand that one. Okay, so that's the Medicare program. All right. Now Medigap coverage. All right, Medicare Advantage. We just talked about kind of an HMO PPO. Right, that's Medicare Part C. What competes with that is a Medicare supplement plan, sometimes called Medigap coverage. Now, there's 14 plans A through N, right? And as an insurance company, you don't have to offer all the plans, but you have to at least offer Plan A. So an insurance company cannot offer Plan B through N, right? They have to offer Plan A at least. Plan A is the core or minimum benefit program in order to call a Medicare supplement policy, right? Another thing that competes with Medicare supplements is Medicare Select, which is kind of the PPO version of a Medicare supplement. That's a rare one. I don't think you'll get that on the test, right? Long-term care provides that nursing home stay we kind of touched on. Like I said, watch the other webinar. Medicare Part A gives you 100 days in a skilled nursing facility. Probably or typically not enough. And so then you might want to consider a long-term care policy, which can give you longer benefit periods. Okay. Long-term care does not provide acute care. That's a high degree of medical attention in a hospital with doctors and nurses. Long-term care covers a nursing home stay, right? Or maybe you're able to be at home having friends and family help out. Okay. So it complements your health insurance at any age. Okay. So at this point in time, I want to say thank you. Good luck with your studies. If you do have questions, please feel free to reach out. You can click on the Contact Us on my website and go ahead and leave a message for me. If you need a little more clarification, you can also reach out anytime. All right? Take care and good luck. Thank you.